Hello, Calaveras County. I'm Mike Taylor, and if we're sitting here, that must mean the doctor is in. Dr. Randy Smart, how are you?
Hi, Mike. Great to be here today. Thank you.
This time around is an interesting one. We were talking a little bit before we started, and I made a couple of assumptions, and it turns out I was correct. Tennis elbow has almost nothing to do with tennis.
Well, it probably depends on where you live.
And who you're playing tennis with.
and who your patients are. But the majority of cases of tennis elbow I see in Calaveras County don't play tennis. Mm-hmm. They do other things that cause tennis elbow. And the other thing that's interesting is tennis elbow really isn't about the elbow.
Really?
Yeah, so we need to rename it.
So what should we be calling it?
Wood chopper's wrist.
Okay.
It's got to have a different name.
All right, so actually, what's going on when we say we have tennis elbow?
So the way your arm is designed is your wrist, when you extend your wrist, there's a bunch of muscles that are connected to the upper arm bone, and they're like pulleys. And so if you feel the side of your elbow and you extend your wrist,
you're
you'll
feeling
feel that
stuff
move,
pulling
right?
around.
And the same thing is when you flex your wrist at the inside of your elbow, you can feel those muscles
that
move.
moves a lot, yeah.
So, right. So there's these big tendons that go all the way down your forearm. They've got muscles up here where the arm gets thicker, and they attach to the humerus, which is the upper bone in the arm. So what happens is people that get a lot of repetitive motion, like a lot of wrist extension, where that tendon connects to the humerus, becomes inflamed and unhappy.
Okay.
And if it's on the outside of the elbow, which is called the lateral epicondyle, that's called tennis elbow. If it's on the inside of the elbow, that's called golf elbow.
Really? I'd never heard of golf elbow.
Right.
So,
and there are a lot of golfers in this county, so there could be a lot of golf elbow out there.
And that probably comes from the locking of the wrist and all that repetitive motion,
and
swinging
the repetitive
club.
motion, yeah.
Okay.
And if you think about a tennis racket, you're doing this. I have to tell you, I know very little about tennis. I don't play tennis. And I don't know if you keep your wrist locked or you move it, but if you're moving it and you have a lot of repetitive motion, and I think the numbers I've seen is if you're doing repetitive motion more than about 2 hours a day, you're at risk for this stuff.
Oh, wow. So somebody who's chopping wood or swinging that tennis racket or golf club, getting ready for the next match.
Exactly.
You're going to be probably stressing those out a little bit. So once everything gets kind of unhappy and inflamed,
it hurts.
It hurts. I have heard that.
It hurts.
Then what do we do?
Right there.
And it's right there, huh?
Right there.
Yeah.
So, interesting, the cases I've seen in Calaveras have been not actually wood chopping, but wood splitting. You know what a wood splitter, right?
Oh, yeah.
So when you do a wood splitter, you put the thing on the thing, you split the wood, and then you throw it one way or the other, and there's a lot of this.
Yeah, so there's a lot of just moving your hands like this.
And nobody splits wood for 15 minutes.
No.
You either split like all day long.
It's the whole morning until it gets too hot, or...
So I've seen it a lot in those guys. I've also seen it... you know what loppers are? Loppers?
Landscaping.
Yeah. Yes, yeah. So think about loppers, and you get out there and you're using the loppers and and the next morning, man, your elbow hurts. But it could be any repetitive motion. I had one patient, very interesting, right here in town, and he was an auto body guy, and he would do a lot of auto body polishing and waxing as part of the job, and and he had a real problem with his elbow.
I'll be darned. And that I could imagine having to do with some of the pressure too, because you're exerting
the force
while you're flexing.
Exactly, the force. So there's people that are a little more at risk for this. Like everything we talk about, if the older you get, the more likely you are to get it.
The more likely it's going to happen.
Yeah, so if you're over 40, I mean, we're trying to find a disease that doesn't do that. But the older you get, the more likely it is to happen. And you tend to see it more in people that these become recreational or sporadic activities.
Oh, okay.
So if you're out playing tennis like a lot, you're probably not going to get this.
Okay.
But if you're,
more the weekend warrior types?
Yes, exactly.
Yeah.
Or like me, if you split your wood like once a year all weekend long, those kinds of things. The people that are doing it again and again and again and are maybe a little better conditioned or a little bit, they tend to not get it. So people that are getting a little bit older get it. People that have sporadic or not daily activities, they tend to get it more. There isn't really a gender difference that I'm aware of. I think men and women get it the same. But boy, when they get it, it hurts.
And what do you do for that pain? And then what do you do to relax everything that's unhappy in there?
So this, for me, as a physician, is a really frustrating problem because a lot of what we do doesn't work very well. I mean, just honestly, Mike. And so if you look at the average case of tennis elbow, they tend to smolder along for 6 to 12 months.
Goodness gracious.
And you try to do this, and you try to do that, and you try to fix it, but for 6 to 12 months, I mean, this goes on, and the good news is it ultimately does go away. The bad news is 12 months is a long time.
It's a long time to have an aching elbow.
Oh my gosh, yeah. Usually it's in your dominant arm. I mean, that's the arm, right? So that's the arm you do everything with.
It's the one you're grabbing the tennis racket or the golf club with. So.
Exactly. And so it can be to the point where you can't sleep. You can't work.
Wow.
You just, it can be really disabling. But it's kind of frustrating to treat. For most of the inflammatory problems we see, we can use anti-inflammatory medications. We've talked about those on the show before, like Motrin, ibuprofen, Advil, Aleve.
And I don't want to misspeak, is that the NSAID?
NSAIDs, yeah. And man, in my experience, that just doesn't work.
Doesn't quite do it.
We try, and it doesn't work. Occasionally, maybe, but so what do you do, right? So the first thing you do is the best advice we could ever give anybody. If it hurts, don't do it.
Don't do it.
Yeah, just don't do it.
Yeah.
So if you're a tennis player, you need to back off. If you're a wood splitter, you need to back off. If you're a lopper, I mean, whatever you're doing, you need to back off. So that's the first thing we do. Now the second thing we do is kind of interesting, and there is a brace called a counterforce brace. And you may have seen this before and not even recognized what it is.
Okay.
But it is basically a band that goes around the elbow. And you could say, well, that's like a sports band or...
Oh, I have seen those.
Yes, exactly.
People.
Yeah, so it's a band. Now, there are different kinds of bands. There's some that are, pretty wimpy, and there's some that are better. But these counterforce bands seem to have a beneficial effect.
Are they constricting everything?
Yes. So what we believe happens is it prevents that muscle from bulging out, and people tend to restrict their motion a little bit.
The constriction here reminds them.
Right. Because actually, if you hold this area, and then you start moving your wrists,
flexing, everything's moving around in there. And it's amazing.
You normally go, well, maybe I won't move it so much because I got this thing on my elbow. So this counterforce band seems to be effective. They're available in drugstores. Physical therapists have them. But again, there is a spectrum of not so good to good. And I couldn't give you a brand name right now. I haven't been to the pharmacy in a while to look at that. those can be very effective.
Is there such a thing, and maybe this is a dumb question, but because I know there is such a thing as too much of that constriction, but I mean, I would imagine that these bands intended for that don't come in a version that's too tight. I guess that's what I'm asking. Is there such a thing as, squeezing it all too tight?
Anything could be too tight.
Yeah.
And so you don't want it to be so tight it's uncomfortable. Mm-hmm. And you don't want it to be so tight that you start to have any kind of swelling.
Oh, okay.
I mean,
mm-hmm.
Judgment. Mm-hmm. But you don't want any swelling. You don't want it to be uncomfortable. It should be firm.
Yeah.
It should feel firm. It should feel a little bit constricting, but not...
But not like you've got a tourniquet on your elbow.
Right. Exactly.
Yeah. Okay.
Exactly. And then one of the things I actually think works really well, and there isn't a lot of science behind this, is some of the topical medicines, like Bengay, Icy Hot,
mm-hmm.
And there are even some prescription versions of these medicines. Those over-the-counter medicines have something in it called methyl salicylate, which is an aspirin derivative.
Mm-hmm.
And I've had patients that, just rub that in a couple times a day with the band and, not playing tennis and,
mm-hmm.
and have had better results.
Okay.
So as first-line therapy, once we're sure about what's wrong and what we're doing, we don't do anything that hurts. We maybe get a band and put it on and maybe start using some Bengay or Icy Hot.
Mm-hmm.
And we do that for about 6 weeks.
Okay. And then kind of see how it's going? I mean, is this something that, it doesn't sound like it, but I'll ask anyway, after a week of wearing the band and, not playing tennis, you're not going to get much relief, it doesn't sound like.
It's slow to respond.
It's such a frequently used batch of muscles. Just doing these couple of moves with you here now, I realize, holy cow, you're always moving this.
All the time.
And so I could imagine that the only way you could completely immobilize it is to practically cast it. It almost seems like to me.
Yeah.
And obviously nobody wants to do that. So what do we do if this doesn't get any better with some topical creams and some constriction?
Right, which is common. So we have them come back at 6 weeks, and what I'm looking for is not resolution. I'm not looking for a guy that says, man, it's all gone, I feel better.
Yeah.
Mm-hmm. What I'm looking for is just something better. If it was an 8 out of 10, could we get to 6 or 5 out of 10? And if it's something better, then we just keep doing it.
Oh, okay.
But if they come back and say, I can't take this, I can't do my
can't
job,
sleep.
I can't drive the truck, I can't sleep, then the right thing to do is to take some x-rays.
Mm-hmm.
And normally we don't take x-rays at the start because it's normally not a bony problem.
That's what I was going to think.
But if they come back and they're not doing well, we'll take some x-rays just to make sure there isn't something we're missing. And then we really push them to go to physical therapy.
Oh.
And the physical therapist actually can do a lot with this. If you got the time and the insurance, the physical therapist can do a lot with this. But it requires compliance and, commitment.
Is it kind of teaching you to make those movements a little differently? Or
exactly.
Oh, is it? Okay.
So if you're a tennis player, and I'll tell you something interesting, Mike. If you're a tennis player, your chances of having tennis elbow in your lifetime are almost 50%.
Really? Wow.
In your lifetime.
Mm-hmm.
Yeah. Now, those aren't the cases I see,
mm-hmm.
But it's pretty high. But if you're a tennis player, there are changes the physical therapist can make in terms of the kind of racket, the size of the handle.
Oh, really? Okay.
How you grip the racket.
Wow.
If you're a competitive tennis player, then a good tennis coach can help you with that.
Because you're going to change the way you're making your shots.
Exactly. Mm-hmm. Yeah, they should have knowledge of that. So on the second round, we keep doing everything we're doing on the first round, but then we engage the physical therapist, and Sometimes I'll try the oral anti-inflammatories, the ones that don't work.
Oh, okay.
Because I'm looking
Just
for
to
something
see if that
doesn't
spurs it into helping.
So then, what do you do if they come back the third time? And that's very common. Is you can use steroid injections into this area.
Okay.
There's a lot of controversy about that. Some people think that makes it last longer. It goes away for a short period of time, feels better, but then it takes longer to resolve. But I have seen cases where steroid injections combined with some of these other things really made a difference.
Okay.
Now, steroid injections probably by themselves without any other probably is not a good idea.
What are the steroids, what does the drug actually do when it gets in there? Does it actually make it not swell or make it not be irritated?
Anti-inflammatory.
Yeah, okay. It serves in that purpose.
So
okay.
NSAIDs are, the sort of standard anti-inflammatories. But steroids, and the most common one is prednisone.
Okay.
Another one is called Medrol. Another one is called dexamethasone. But these steroids are very powerful anti-inflammatories.
Okay, I didn't realize that.
So if there's an inflammatory component to this, and there usually is, those steroid injections will help. But it's really got to be... Sometimes the strategy can be steroid injections so they can do the physical therapy, so they can start doing the stuff.
And learn to move in a different way and not re-inflame everything.
There is an interesting exercise. I haven't tried this in a lot of patients, but I'm kind of anxious to. So if you're out there and you have tennis elbow, let me know. I'd like to try this. But there is an exercise where you extend your arm, and then you flex your wrist.
Okay.
Now you take your other hand and you tighten that up.
Pull it a little more.
A little more. And you hold that for 30 seconds.
Wow, okay, because that really seems to pull
feel it,
up
right?
here.
You can feel it.
And not,
But that could be a home remedy that might be helpful. It's not dangerous. But fully extended, fully flexed, and then you just give it a little bit extra.
Just give it a little extra pull.
Right.
And do you do that in both directions or just the down, just this way, because you're...
Well, the other direction would be for golf elbow.
golf elbow.
Yes, right.
Yep. I just noticed that when I tipped my arm up.
Golf elbow.
That's right.
Right,
That's
exactly.
right. I'll be darned. So there's a little bit of homeopathy that can creep into this too.
There are things people can do, yeah, exactly.
Do we ever get into a surgery situation with this?
So what do you do if they come back the fourth time, right?
So
and
now
that is common.
Now we're what, maybe 8 months out?
Yes,
okay.
6 to 8. So the surgery can be done for this. It's not done a lot, but it can be done. And it can be done here in Calaveras County. And typically the criteria, if you will, for surgery are somebody who's been at this for 6 months and they're just not getting better.
Nothing's working.
Nothing's working. Somebody who's been reasonably compliant with the other measures, who have tried. And then often we'll send them to an orthopedic surgeon, and what they will do is they'll do an MRI of that area to better understand the anatomy and the inflammation. And from there, then on occasion, they can go in and operate.
Okay.
But it's very interesting. It is if you were to look this up, they go through almost hundreds of potential remedies. You could try this, you could try that, you could try this. Lots of them, not 100, but there's a lot. And as a rule, the more remedies somebody has for something, the more likely it is that nothing's working.
Nothing is working.
Yes, exactly. Nothing's working.
Is that because over time people have just tried everything out of kind of desperation?
Because nothing else. Yes, exactly. Yeah.
Does ice or heat help at all?
I'm glad you asked that. I overlooked that. Ice can be helpful.
Okay. Because that pretty much helps with swelling and inflammation.
Right. So heat is probably not all that helpful. But there is some anecdotal evidence that ice packs can be
Okay.
helpful.
Can that maybe be kind of a, you've spent the weekend, like you say, splitting wood, and maybe you're sitting there Sunday evening and the elbows are feeling a little creaky maybe. Would that be, maybe ice them up for a little while at night?
Throw a little Bengay on it, ice it up a little bit.
Yeah.
Sure, absolutely.
Okay.
And
then maybe...
kind of baby it for a day or two. Yeah, absolutely.
Yeah, because goodness knows you don't want to be splitting wood 4 days in a row. So
No, no.
what? It sounds like there kind of is in the don't do it, but is there something we can do to kind of prevent this from starting? I mean, you're stuck. You're going to have to split that wood. Should you be, kind of exercising for a couple of weeks before it's, wood cutting time to,
so
get the elbows flexed?
Can it be prevented?
Yeah.
I've often wondered about that because I've had some of these patients come in again and again. A year goes by and they come back and they say it's back. And I have often wondered if you put a wrist brace on them,
like for carpal tunnel?
Yes, exactly. Like a wrist brace where they have limited flexion extension. Then you say, you can go play all the tennis you want, or you can split all the wood you want.
Yeah.
But with the brace, and I've not seen any clinical research that has looked at that, but I think it would be an intriguing thing. It'd be a great thing for a medical student or a resident to look into.
Work on for their
if we put
thesis.
these guys on, yes, exactly.
Yeah.
If we immobilize their wrist, are the recurrent patients going to be okay?
Because that typically helps with carpal tunnel, right?
Oh yeah.
Yeah, so
absolutely.
I would think that instead of the swelling and inflammation being here, and it being here, that same immobilization, I would think would help. But yeah, medical students take note.
Right. If it were me, honestly, I've actually had tennis elbow once. Gosh, I think it was 15 years ago, and I was working in the woods, and I cut a lot of stuff. And I hurt for the next several weeks, and man, it hurt. But if I was one of these patients that had a recurrence or it was a chronic problem, I'm pretty sure I'd wear a wrist brace.
Yeah.
No, nobody should wear a brace 24/7, because you'll have atrophy, loss of function.
Yeah.
But if you're doing the activity that is the culprit or the trigger for this, man, I think I'd do it.
Wear the brace while you're splitting the wood.
While you're playing tennis or
playing
splitting wood or
okay.
polishing
And not
the car
necessarily while you're sleeping, when you're not
Right.
as apt to be flailing your arms around anyway. Okay, that would seem to make sense too. It's one of those things, I haven't experienced it. I've talked to people, we talked here when we were talking about carpal tunnel, and I experienced that, and it was one of those, not moving the wrist, kind of immobilizing it. But I have noticed since then, speaking of carpal tunnel, that I try to not sleep in that with the wrists curled up
is that
like
right?
this.
Yeah.
I have. I consciously kind of tried to straighten the arms out.
It's almost a reflex, though.
It really almost is.
I think it's a protective reflex.
Something about returning to the fetal position or something.
Yeah, so your gut's not exposed. You can't be slit open.
Yeah, that's right.
Something like that.
Yeah, you must know the neighborhood I live in. But no, I'm kidding. But so we're getting down to our last few minutes, and so we've got this achy darned elbow because we overdid it last weekend.
Lateral epicondylitis.
Okay. I'm glad you said that.
Right. I had to throw it out there. So,
That's right.
So there are actually centers that, specialty centers that specialize in
The Adidas Tennis Elbow Center.
Yes, they do. Yeah, there are centers that do that.
Wow.
And I've never utilized those in my practice. I would imagine there is one somewhere in Northern California. But if you're a professional tennis player,
You've probably worked with either the physical therapist or the coach who's helping you do those moves that aren't going to leave you achy and breaky, I was going to say, but yeah,
Right.
achy and broken.
So if this is a big income, business expense, professional athlete, then those kinds of centers become more important.
And they make sense. And sports medicine has, gosh, done just about as much as regular medicine in the past 10 or 15 years. So,
Exactly.
yeah.
Exactly.
So the elbow's aching. You might want to throw some ice on it tonight before you go to bed. Rub it down with some Bengay or Icy Hot as
Perfect.
you go to bed.
Perfect.
And then if you've got one, maybe tomorrow, throw it into a wrist brace just so that your arm isn't, or excuse me, yeah, get one of those.
An elbow band.
It's elbow band, okay.
Yeah, elbow band.
That's the first try, and that's the one that some people experience some relief with. This just sounds like something that could seriously drive a patient crazy.
Absolutely.
How do you keep
It drives
them?
me crazy.
Well, I was going to say, especially, a physician who is, trying to care for these patients who keep coming in going, when are you going to fix this?
Exactly.
And so how do people balance sort of the mental when it feels like you're not making any headway? How do you encourage people to sort of trudge through and battle through and stick it out for maybe as long as a year?
Chronic illness can be depressing. And a lot of those patients sort of deny the depression, but we look for it. And whether it be chronic pain or chronic anything, chronic debilitation, it can be depressing. And sometimes the depression becomes more of a problem than the pain.
Than the actual pain.
Or the disease, right. And so you could have migraine headaches. And you don't have them a lot, but you can't control them, and you're young, and you want to socialize, and you have friends. And so that can become really depressing. So sometimes you end up with more than one problem. Now, we always try to fix the first problem, the migraine headache or the tennis elbow, always. But you're right. Over time, they can come in and say, I'm not having any fun. I'm not doing well at work. My family's not happy. I'm just not the same person. And sometimes that can be a big factor in their health. Yeah.
So it's a matter of kind of soldiering through with tennis elbow, it sounds like.
Well, and my job is to say, there might be some depression, and let's talk about that. Now, that doesn't mean everybody needs an antidepressant.
Yeah.
Most people do not. But if they recognize the depression and you can talk to them about it, then you can really help them through that long year of tennis elbow.
And with that, ladies and gentlemen, take care of your elbows. Be careful cutting wood, and, well, like the doctor says, if it hurts, don't do it. Sounds silly, but it is that simple. So, Dr. Smart, thank you very much.
Thanks, Mike.
Ladies and gentlemen, I'm Mike Taylor. For now, the doctor is out. See you next time.